We are aware of new numbers that were reported overnight from China, which added an additional 325 cases and 1,290 deaths from Wuhan. And this was done in an attempt to leave no case undocumented. What we understand is that they've used an existing law of statistics to find these cases. And what they did is they reviewed different databases. They looked at the database that is kept for all of the confirmed cases. They looked at their funeral service systems. They looked at hospital systems. They looked at laboratories to see if there were any duplications or if there were any cases missing. They looked for cases in fever clinics and hospitals, detention centers, and elderly care centers as well. And what they have reported is that the discrepancies in these cases were due to a number of factors. First is that the healthcare system in Wuhan was overwhelmed at one point, and some patients died at home. Secondly, is that medical staff were delayed in reporting of these cases because they were focused on providing care for those patients and they didn't fill out the forms in time. Next is that there were additional locations that were built. And if you remember, in Wuhan in particular, some of the hospitals themselves were overwhelmed. And so they set up these makeshift hospitals that they called them, which were essentially stadiums and other facilities where they put mild cases to be cared for. And in those situations, the reporting wasn't done in a timely manner. And so those cases were added. And in some situations, the reports weren't filled in completely. And so what they did is they did a review of that and they revised their numbers, and those were the numbers that were updated overnight. It is very important to know the numbers of people who have died from COVID-19 because this is of public health importance. And it is important that we have the accurate reporting of this. And in such, WHO has developed some guidance around this, which is for their international guidelines for certification and classification of COVID-19 as a cause of death. And this is based on ICD codes that exist. And our primary goal is to support countries in their ability to classify people who have died from COVID-19. And I just want to say that this is something that is a challenge in an ongoing outbreak, to identify all of your cases and to identify all of the deaths as an outbreak happens, especially if systems are overwhelmed. I would anticipate that many countries are going to be in a similar situation where they will have to go back and review records and look to see, did we capture all of them? I've seen a number of reports from media where people have been in a number of different countries where people have died outside of a hospital system. And so it will take some time for those individuals to be classified. So it is important that cases that do die from COVID-19 are recorded, and we've provided some guidance to support countries to do so.